Hello, good evening, and how are you? Welcome to another session of Ask the Doctors. Yes, I'm happy to be here with you this Sunday. Today is the last day of the year today, and I'm happy to be here. You, how are you? Now, a lot of people are saying, Doctor, why are you coming online? Today is the last day of the year now, Abby. So let's have a session together. Let's discuss, let's gist. You understand? And that is why I'm live today. I can see already I'm live on Facebook, I'm live on YouTube, I'm live on Instagram, and I'm live also on TikTok. Yes, I can see you. Happy New Year. I say happy last last day of the year. Abu Aisha Oladimeji. Rosaline, I see you. Ultimate Building Apostle, I see you. How are you? I'm live so on. Yes, Nakaka evening. How you doing? So tonight is a question and answer session. In case you have questions for me, feel free to ask me your questions. So let's gist. Yes. How are you? It's the last day of the year 2023, and this year has been wonderful for me. I don't know about you, but I felt it's important that I come online today. Last Sunday, we went online, you understand, because of the whole Christmas stuff. But today, decided that we have to be online. And my friend, Dr. Israel, Daniel, I see you. Daniel on Instagram, I see you. Those watching me on TikTok, I see you. Nemeka, I see you. Doris, good evening. Chioma on Facebook, good evening. Ben Juliet, good evening. How are you? Good evening. I'm doing very well. I'm doing good. Indam, good evening. How are you doing? So tonight, I decided that let's just come online and take some questions. Tell me anything that you want to ask me today. If you wanted to ask me something, so use this opportunity to ask me today. Roslyn, I see you. Yes, Zeus, I see you. Candy on Instagram, I see you. How are you? Thank you very much. Those watching me on TikTok, how you day? Those watching me on TikTok, how are you? Yeah, okay. Yeah, I'm good. I'm good. So if you have any questions, please feel free to ask me your questions or let's just gist. People on Instagram, let me see if I have any question here. Good evening. Yes, welcome. I can see you all on Instagram. Yeah, you can see me and I can see you. I'm also live on talk. Yes. So ask me your questions. Any question you want to ask me, feel free to ask me. Somebody says, good evening. Okay, good evening. Yes. See this comment here. Doctor, tomorrow is New Year. Hope you buy cow. Well, the cow where I buy, it don't escape. He escaped. I've been buying one cow, very big cow. The cow escaped. I just tell them make them leave the cow. You get man, no truth of myself. Candy Kiss on Instagram is asking me a question. He says, please, I have a quick question to ask. I've been coughing for the past 1 month now. Please, what can I use? I'm tired. Okay. Candy Kiss on Instagram. I see you. First of all, those on Instagram, please like this video. Like, click on the like icon there and help me here. Okay. You have been coughing for the past 1 month and you are tired. What have you done? What have you taken? Who you seen? It's important we find out because you can't just say I'm coughing and then I take 1 month. Are you coughing out anything? Any chest pain? Any weight loss? Any night sweats? Have you done X-ray? What medications have you taken? Who prescribed the medications for you? These are very, very important stuff to find out. You understand? Um, when you tell us, then we can know how to advise you. Because I always tell people that I don't prescription on social media. You get. So in case you are asking me any treatment online, I'm sorry, I may not be able to prescribe any treatment for you on social media. But it's important you tell us so we know how to advise you. Because if you are coughing for 1 month, it's important. I don't know what you've taken. If you've done a chest X-ray, these are stuff that would help you. Yeah. Good evening. Happy New Year in advance. Good evening, Agbesi. Happy New Year in advance. So Israel was supposed to join me online tonight, but there was a miscommunication. You understand? He's somewhere very, very busy, and that is why he can't hear. We even agreed not to have this session tonight, but we had the miscommunication. That is why you see me here. Hmm? Okay, let me take some comments again on Facebook. Hi, doctor. Happy New Year. After taking Zobo, I have been having urine incontinence. Please, what could be the issue? Okay, Mr. Daniel on Facebook is asking me a question. Baz Betsy on TikTok, how you there? If you know that the cause of your problem is because of Zobo, stop the Zobo. As a matter of fact, there is nowhere in the medical literature that Zobo causes urinary incontinence. Do you even know what urinary incontinence means? So Zobo does not cause urinary incontinence. I feel something else might be causing your urinary incontinence. So the best advice I'm going to give to you online because of your comment here, stop the Zobo. Examine yourself again, watch it out if it will improve. If it continues, then you would have to see a doctor. You understand? Yes, to help you. You are just coming, you are welcome. I'm live on Facebook, I'm live on YouTube, I'm live on Instagram, and I'm live on TikTok. So wherever you're watching me from, it's nice having you here. So somebody's asking me a question on Instagram. Engineer Cristiano, good evening, doctor. Please, which multivitamin drug can you recommend for somebody to take? As you know, fruits are very expensive now. Thank you very much. Okay, let me correct something quickly. Let me correct something. Engineer Chris, fruits are not more expensive than your multivitamin. Don't let anybody deceive you. Multivitamins or multivitamins are more expensive than your fruits. Do you hear me? Multivitamins are more expensive than fruit. Fruits are cheaper than multivitamin. So don't come with that excuse that you know fruits are expensive. Multivitamins are cheaper. It's a lie. It's totally false. I would encourage you to take more of fruits than looking for any multivitamin or any supplements first. I'm not telling you that multivitamins are bad, but in the hierarchy of taking vitamins, I prefer you take your fruits, your oranges, your watermelon, anyone you can afford. Cheap. If you know that you can't afford fruits, there is no way you can afford multivitamins because the very good ones are a little bit expensive. The cheapest one is like 5,000 naira. The cheapest multivitamin or the cheapest supplement, maybe 4,000 or 5,000 naira. But you can get a fruit of 200 or 300 or 400 naira. Sure, you get, Mr. Chris. Yeah. Okay, let me go back to Facebook. Um, let me go back to Facebook. I have a lot of people on Facebook watching me. Oh, yeah, those on Facebook, share the live, share the live. Happy last Sunday here of the year. Happy last Sunday of the year to you. Yeah, welcome, welcome. Same here. Okay, if you are just coming, welcome. I'm live on 4 platforms tonight. So in case you're not making your comments, it's just me time. I would come to you. So let me go to TikTok. Somebody's asking me a question on TikTok. Mommy W says, is it advisable to get rid of fibroid when it's not disturbing you? So if your fibroid is not causing you any problem, no doctor would tell you to remove it, to go for surgery. You understand? So somebody on TikTok is asked a question and says, if your fibroid is not giving you any symptom at all, should you go for removal of the fibroid, that is surgery? No doctor will tell you to remove your fibroid now. The number one indication for surgery for fibroid is when you are having symptoms. So if you are having no symptoms, no doctor will tell you to remove it. My best advice for you again is to um, speak with a gynecologist. Yes. Okay. So I'm back on Instagram. Let me take a comment on Instagram. Yes, Candy Kiss is asking us to say, I'm spitting out. I took cough syrup and currently taking Renocal. Okay, Candy Kiss, these medications you are taking, we are interacting online. Who prescribed these medications for you? The medications you are taking, the cough syrup and whatever antibiotics you are taking, who prescribed them for you? Huh? Yes. Tell me quickly. Let me go back to Facebook. Mr. Alex, happy last Sunday of the year. I see you. Welcome. Hey, Modupe, I see you. Welcome. Thank you, everybody. Tell me what you learned on my page this year. Everybody watching me on Facebook and YouTube and even on Instagram, tell me what you learned this year. Mr. Alex, I see you. Honestly, I do appreciate your support. Thank you so much. Okay, let me take one more question. Doc, seriously, thoughts came to my mind. What do you say about the new method of people doing abortion? About some doctors injecting ladies and later the baby will, okay, and this will give normal way of delivery. So I don't understand your question. Esther, what are you trying to ask us online? What are you asking? It's not clear. New method of which one is new method? I don't understand your question. So please ask your question again. Okay, let me go back to Instagram. Kenichi on Instagram says, Doctor, please, is it good for ulcer patients to drink energy drink containing caffeine? If you have been following me very, very well, whether you have ulcer or you don't have ulcer, if you they follow my page, nobody say you dey do like you understand. You know my stand on energy drink. I don't encourage anybody to take energy drink. Whether you get ulcer or you have ulcer, my advice to you, leave energy drink alone. And if you have ulcer and you're taking energy drink, just save money, oh, because you will pay for medical treatment. You will suffer. That's just the truth. You will suffer in the future. So avoid it. The advice for you, if you have ulcer, I've made so many videos about ulcer. You can go through my page, you will see them there. So leave energy drinks alone if you love yourself. Yeah. Okay, let's see. If you're just coming, you're welcome. If you're watching me on TikTok, you are welcome. I have this call coming in. No, no, no. I'm live. I'm live. I'm live. I'm live. I'm live. Let me see. Somebody is calling me. Let's see. I'm coming. Let's see. I'm coming. Let me see. Okay. 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 Winners. Sorry. What can cause a woman to have period 2 times in a month? This thing, I already talk about them before. I don't do video about this your question. What can make a woman have period 2 times in a month? There are so many women, There are many women with having period 2 times in a month, and it's normal. It's normal. Women have their period 2 times in a month, and it's very normal, especially when you have a short menstrual cycle. So, if the length of your menstrual cycle is 21 days or 22 days, you can have your period twice in a month. You understand? Yeah. Not every woman will have period once. Some people can even have their period once in 2 months, once in 2 months, and it's normal. So the advice for you, Mr. or Mrs. Winner, is to know the length of your menstrual cycle first. If your menstrual cycle length is 21 days, you have no problem. But if your menstrual cycle is 30 days or 35, and now you are seeing your period twice in a month, there's a problem. So the first thing is you must know the length of your menstrual cycle. Now you want to ask me, how do I calculate the length of my menstrual cycle? All I want to do is All I want you to do is please go to my YouTube channel, go to my YouTube. You're on YouTube, right? Look for the video on how to calculate the length of your menstrual cycle. Watch the video because there are so many things you need to know. You watch the video, then you would understand how to calculate the length of the menstrual cycle. Is that okay? Yeah, let's see. Somebody says, let me see. Okay, those on Instagram, I'm not seeing your question again. Let me go back to this. Okay. Oluchi is asking me, do you want lion? Do I want lion? Lion. So the lion is that. I beg, waiting Zobo do now. Just finish drinking it now. Yes, I just finished taking Zobo. It's great. It's great. Okay, let me take some questions here on Facebook. People, people are not sharing this live. Doctor, does malaria resistance exist? If yes, what is the cause? Because I've started treating malaria every 2 weeks. After treating just 1 week, it comes back again. Chioma, please, oh, listen to me carefully. Who they treat you for malaria every 2 weeks? Chioma, who? Let me say this online. If you are treating malaria every two weeks, there's a problem. It's either you are treating the wrong medical condition. It's abnormal to be treating malaria every two weeks. You might have a medical disorder somewhere that might be disguising as malaria. Yes, malaria resistance exists. We have so many malaria right now that do not work. You understand? But if you are having malaria every two weeks, hear me and hear me well. There's a problem. I don't know where the problem is from, but I can tell you confidently online that there's a problem somewhere. Either you are sleeping with mosquito, or you have a problem in your system generally. You have a metabolic disorder, or you have immune suppression, or something else is causing your problem. It is totally abnormal to treat malaria every 2 weeks. I beg you, go and see your doctor so that your doctor can examine you holistically, can check totally. Our people just believe that whenever they have head and body pain is malaria. Whenever you have head and body pain, malaria. Oh, Antinos, give me malaria medicine. Oh, pharmacy, I need malaria. Whereas you might have another problem that you don't even know. I beg, Choma. So go see the doctor, make he check you. Can you talk about fat in the liver? Somebody on TikTok says I talk about fat in the liver. What about fat in the liver? Yes, you can have fat in your liver from your lifestyle. It's what we call um, fatty liver disease, alcoholic fatty liver disease, and non-alcohol fatty liver disease. So you can have fatty liver disease from different sources. One can be from alcohol related, the other one can be from your lifestyle. You understand? So if you want to know about fatty liver, what exactly are you asking? Blessing, I see you. How you day? Dr. Blessing, how about now? Okay, let's take some comments again on Facebook. Please, I want to ask if it's okay to be giving children vitamin C every day. Hope no side effect later. Una no they watch my video. I don't do video about vitamin C. I made a video about vitamin C. I made a video about supplements. I made a video about vitamin B. I have a video I will release next month on vitamin. Yes, vitamin C is very, very good, but there is a clause there. We would not tell you to just continue taking vitamin C for continuous like that. Give your body a break. If you must take vitamin C, you can take vitamin C from your food. However, if you want to take vitamin C because you like it, you can take it for maybe 1 month. If you feel like taking it, then give your body a break. You know why? Vitamin C can cause kidney stone. When you use it, it can increase your risk of developing kidney stone. I don't do video about vitamin C before. E dey Facebook, e dey YouTube, or e no dey TikTok, no dey Instagram. Because Instagram and TikTok na very, 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 very app. So I know they waste of my videos on those. No why now. Eh. Um, My last question, please. What is the major cause of high blood pressure? Okay. Somebody is asking me a question on Instagram. So those on Facebook and YouTube, I'll come back. There are many causes of high blood pressure. Number one is that you might not even cause high blood pressure. You might have no idea. It's called essential hypertension or primary hypertension. You might not even know why. You don't smoke, you don't drink, you have no family member with hypertension, you don't stress yourself, you exercise, you can't really explain, you understand? That is number one. Then there are other causes of hypertension. Your age, your lifestyle, you smoke, you take alcohol, you don't exercise, you eat junk food, you have a family member with hypertension, you have hormone disorders, you have endocrine, we call them endocrine issues like hyperthyroidism can cause you and other hormones. You have problems with your kidneys, some of the things that can cause hypertension, or you even take certain medications without doctor's prescription. These are some of the causes of hypertension. You understand? So people tell me that, or when they go to hospital, see their doctor, doctor, but I don't get them. Oh, you know my family. Oh, sometimes you might not even have it in your family. You understand? So um, primary hypertension can arise without any known cause. That is number one. Then the other cause of hypertension, your lifestyle. Even if you are obese too, you can develop hypertension. Yeah. Someone who has been taking medical to get fat, and now doctor says she have fat in the liver. Nikki, your question is still not clear. Somebody who has been taking medical, what do you mean by medical to get fat? So we have a comment on TikTok. If you are just coming, you're welcome. I'm live on Facebook, YouTube, Instagram, and TikTok. So I'm trying to move around all this app to answer your questions. Somebody's asking me a question on TikTok. Says somebody has been taking medicine to get fat. Let me tell you, if you are listening to me and you are a woman or you are a man and you are taking medicine to get fat, I'm not going to say it, but read my lips. You will yourself. You will yourself, whoever you are taking medicine to get fat, you will yourself. But una no dey like here oh, una like to dey buy things online. Then when problem don come enter your body, you go come dey find doctor help me, help me. Right now, we are giving you free advice. Do not take anything to gain weight. Many doctors, we've made a lot of videos online. If you want to gain weight, sometimes if I do everything yet, you won't still gain weight. Leave yourself like that. But no, social media don't pressurize you. Your boyfriend or your man friend or your peers don't push you. Therefore, you go to buy things, drink, and then when problem don't come enter, you're running. So the best thing I'm going to beg you again this year, don't take anything to gain weight. Now, if you have taken something to gain weight and you are now developing fatty liver, the best advice for you is to see your doctor. They will carry out some tests on you, they will carry out some blood tests, and they will carry out a scan for you. They will tell you the extent of the fatty liver and what you can do to correct it. You understand? But my advice for you online is please, madam, do not take anything to gain weight. Huh? Okay, let me go back to Facebook. My Facebook people, what are the causes of generalized body weakness and body ache? I beg, I beg, let me say this. This is just a platform to teach, not to treat anybody. Oh, I beg. In case you are having generalized body pains and you're having generalized body weakness, you are looking for the solution on social media, you will not get it here. You only get it at the hospital or when you have a private consultation. But generally, many things can cause you weakness of your body from stress, from not eating properly, from nutritional deficiencies, from infections, from metabolic disorders, from autoimmune diseases. You can have generalized body weakness and body aches. Even some form of immunosuppression. You can begin to have body pain. Problem from the liver can give you these symptoms. So Anything can give you body weakness and body pains. Many sicknesses in the surface of the earth come with body weakness, body pain, maybe headache, maybe fever, maybe loss of appetite. You understand? So you can't just come and say, I want to know why I'm having headache, body pains, and weakness. Many things can cause that. Yep. Okay. Compliments on the season, everybody. If you're just coming, you are welcome. I see people watching me on Instagram. Let's see. Um, okay, let's take this comment here on Facebook. Doctor, why do I always feel the urge to poop almost immediately after eating? Almost immediately after eating. So if you are having that sensation, so this is what we want to find out from you. How long has this been happening? Has this been happening to you all through? You understand? You can't just be having this sensation like that and like it's okay. First of all, it's abnormal. So what can cause it? There's one condition we call early dumping syndrome. So eat, you run to the toilet. You understand? Sometimes you might have um what we call GIT disorders. I'm using this word deliberately. GIT disorder. So as you finish eating, your stomach, your intestine cannot absorb what you finish eating. So you run down to the toilet. You might be autoimmune too. So there are many things that can cause this. But one very important question I want to find out from you is how long has this been happening? Happy New Year in advance. Is it good for a woman to be taking folic acid every day? If you be a woman, and you dey plan to get belle and you are hoping to get pregnant, um, please start taking your folic acid. Very important. One folic acid daily. Or if you be woman and you know the plan to get pregnant, you know get plan of getting pregnant, you can get your folic acid from your food. Folic acid is found in your vegetables, um, your meat, your fish. You get folic acid there, the normal amount your body needs. But if you are a woman and you are hoping to get pregnant very, very soon, the advice for you is to start taking folic acid. You understand? Uh-huh. I've made a video also about this, and the video is on YouTube. The video is on Facebook. Please watch it. A boy of 5 years that can't communicate, is it a sign of autism? No. Can autism child ever communicate well in the future? Yes. Now, the reason I said no is because I'm not going to confirm your diagnosis for you online. What I think you would want to do is to see number one, a pediatrician. The pediatrician will now refer you if there is a need to see a speech therapist. If there is a need, the pediatrician will refer you to see a neurologist. But just coming online and saying that because a child can't speak, can't communicate at 5 years, therefore the child has autism. No. People should stop this habit of I have headache, I have hypertension. You just see one problem and you make the diagnosis like that. No, that's not how it works. There are so many factors to consider before you arrive at any diagnosis. So I'm not going to say that child has autism. Never. What I think you should do is let the pediatrician review that child for you. Yep, yep, yep. Okay, let's go back to Facebook. Oluchi says, in fact, doctor, you and your colleagues have done a lot for us this year. I have learned a lot, mostly your method, making us to know the benefits of eating fruits daily. The day you guys talked about IVF, I learned a lot. Your general advice on importance of visiting the doctor when we have problems, then self-medication. Or may God bless you. God bless you too for this great opportunity to make sure we have good life. Next year will be a year of blessings to everyone. Amen and amen and amen. Yes, next year will be a year of blessing to everybody. So let me just say this. Let me give you that. Let me just let the cat out of the bag. Well, those in my private channel, They have seen the video. Hmm? Those in my private channel, my subscription members, they have seen the video. The video will come out later. The video on the next fruit challenge. So we're going to have our fruit challenge coming very soon. The dates and other stuff, I will let you know as we enter the new year. But those in my private Telegram channel, those that have subscribed, they have seen the video. I've uploaded the video there for them. We have communicated. But you that you are looking at me, you are not in that subscription page. Sorry, don't worry. When it's time, I'll upload the video for you to see. Yeah, thank you, Oluchi. Oluwayemisi, good evening. Good evening. How are you? Let's see. Okay, let's take a comment here on Instagram. Please, what would be the cause of 27 years old seeing sperm? Seeing sperm where? I don't miss this comment. Sorry. Doctor, please pardon on this question. This one is happening to me, and I'm suffering from arthritis for long now. Sometimes it took me to the extent that I have to pause a while before I can move. Okay, I can see one of my teachers on Instagram already. Good evening, sir. So my guy, Engineer Chris, I don't know if you have seen your doctor. I don't know if we want us to lie to you. Most doctors will tell you that when you develop arthritis, there is no permanent cure, like permanent. There's a reason I'm using this word, like, because we're online. There is no permanent cure for arthritis. And it's important you arrive at the diagnosis made by a doctor. If you have arthritis, your doctor will tell you, okay, do this, ensure you massage, you understand therapy, ensure you burn down on excessive weights, you understand, avoid this and avoid that. But there are some people I've seen on this social media, they will tell you that they have the tea to cure arthritis. They will chop you. There is no cure right now, understand? The medications for arthritis will just relieve the pain. And then somebody will come on my page and say, forget, I have the cure. They will chop you. So for now, I will advise you, if you can afford it, see an orthopedic surgeon. If the arthritis is very, very bad, I greet you. I see you. Thank you. Thank you. If the arthritis is very bad, see an orthopedic surgeon to help you. Thank you for the gifts on TikTok. About how you did now? I greet you, sir. Let me take some on Facebook. Good evening. Please, if a pregnant woman go for tests, urine tests, and the doctor said they have blood in the urine, what does that mean? Is it infection or is it normal? My dear, I doubt if na doctor you see. I greet you. I doubt if na doctor you see because no doctor will see a pregnant woman, and I make bold to say it online. No medical doctor will see a patient. Let me even use the word the patient with blood in your urine or protein in your urine or leukocyte, whatever in your urine, and leave you without explaining to you. Not when you are even pregnant. They will tell you. So your doctor will tell you anything. It's not enough to just come online and say, what does it mean? My concern is why didn't your doctor explain this to you? Who they manage you, madam? You see why we dey always beg people, say every profession get their level of knowledge. Even among doctors get different knowledge. My own knowledge is very small among doctors, right? But why, if you see blood in your urine, it's many things can cause it. Many things. But I'm not going to mention anything here to make you panic. Rather, now your doctor is supposed to see you and say, Madam, oh, okay, there's blood in your urine. Look, we check. Oh, is it that maybe you were having implantation bleeding? Maybe. Is it that you are having threatening? Maybe. Is it that you are having a UTI? Or you understand? No doctor will see you and just leave you like that. So prove me wrong. Let me see. Tell me, where did you go? Who did you see? Waiting the doctor tell you. Oh yeah, waiting he tell you. Oh yeah. Oh. Hello, Lizzie here. Lizzie here, how you doing? Good evening, everybody. Those on TikTok, how you doing? Um, let's see. Okay. Good evening, please. What is the cause of me not going to the toilet? Because 2 to 3 days now, I've not gone to the toilet. Doctor, why? Why? My guy, we are not consulting here. You see, you're asking me why. I can't give you your answer. Oh. I'm just going to give you a general answer. Me and you, we know the consult. This is not a consultation. Do you understand? uh Why? It can be anything. Maybe not your diet. Maybe you dey chop and you know they take enough water, or you know they take enough fruits. You understand? Maybe now you maybe, or maybe you don't go take one medicine wey don't cause you constipation. A general advice on social media, general advice: take more fluid, take more fruits, take more vegetables this period. Or if you know you don't do all these things and e no work, see a medical professional. Make e help you. Off social media, I know they treat people on social media. I dey talk am. I know they do am. E get why. So make I protect myself, protect my license. I no wan enter problem. But my advice to you now: speak with a medical professional privately, so that you get a lot of things wey we go find out. Is it that maybe you don't go take something wey make you go toilet, or this thing don dey do you, dey come, dey go? Let me give an example. Get somebody, the person go talk, say, doctor, every 2 months I dey find am difficult to go toilet. Every 2 months. So 2 months go come, you go get constipation, you go disappear. 2 months go come, you go get constipation, you go disappear. That one, our mind go dey think of something. You understand? So these are some of the things your doctor will want to find out more from you that we can't get on social media. Huh? It doesn't make sense. I beg. No vex, but if you are having this problem, I'm giving you the general advice for you to know. Let's see if I have any questions on Instagram. Okay, there's nothing on Instagram. Let's see. Let me take this comment here. Doctor, what is the best way to deal with chronic stress? And is it normal to develop stress after surgery? Okay, so you get 2 questions here. What is the best way to deal with chronic stress? Detach. Detach from anything that is giving you chronic stress and take time off. Take time off. Give your body time for your body to recover. Let your body calm down again. So if you are going through chronic stress, waiting dey cause your chronic stress. What is causing your stress? Is it your job? Is it your lifestyle? Is it your home? Is it your relationship? Is it family? Find out wetin dey cause you that stress, and then give your body a break. If na work, now let me say this here, without apology. If na your job dey give you chronic stress, and you know, and your mind dey tell you say e be like na my job dey give me stress, then na your job dey stress you. If you dey ask yourself that am I stressed or not, and you dey work, na your job dey cause am. Now let me say this: if you lose your life working, that job go continue without you. Nobody go say because you are the best, we will stop this job because you don't go to the world beyond. The job will continue. So you have to tell yourself, in 2024, I need to be smart, I need to be intelligent, I need to take care of myself. Anything where they give me stress, whether na my job, na my anything, detach yourself and unwind. Go play, go vacation, catch fun, rest. I no talk say make you travel. You must not travel, but give your body some time to rest. And then, can somebody develop stress after surgery? The answer is yes. You can actually develop stress after surgery. So this is why there's what we call metabolic response to trauma. Surgery is a form of trauma. Yeah? That metabolic responses. Stress is one of them. Your body releases certain hormones after surgery. Your doctors will place you on so many treatment plan to help you manage that stress. So yes, you can develop stress after surgery, even after accidents. People can develop stress. Okay. Um, let's see. Please, how do I how can I deal with candida? You deal with candida, madam, by going to the hospital now. You can't deal with candida on social media. So if you, sorry, um, for the person on Facebook, let me take this question on TikTok. Um, Unwa Bunwa is asking us a question. How can I deal with candida? By the way, how do you know that what you have is candida? Most times, doctors are very careful with diagnosis online. You might not be having candida self, or it might be vaginitis, self-induced, chemical vaginitis. You understand? So if you they get this stuff, yes, doctor will prescribe medicine for you, antifungals to help you. But how are we even sure? Say waiting to get na candida. Hmm? Yeah. And then if true true na candida, treatment wey they give you, is it that maybe you know they take the correct treatment or you don't develop resistance? So there are a lot of things to find out when you get this kind of problems. And this is why we are very concerned about arriving at a diagnosis. How did you arrive at that diagnosis? Madam, please, if a man is going to urinate every every second, what is meaning of that? Is something wrong with it? Yes, madam. If you are urinating every time, there's a problem. Full stop. That is number one. There's a problem. You should not be urinating every time. It's called urinary frequency. So for a man, what can make a man urinate frequently? Many things. Number one, if the man they drink water plenty too much, he go dey urinate. Number one. Number two, please, this is not your diagnosis. Maybe urinary tract infection. Maybe the man get prostate disorders, benign prostatic um, hypertrophy, or the man get prostate cancer, or he get problem with the bladder. Hmm, you understand? Or he get a mass, he get something where they press the bladder, where they make the bladder every time it go past urine. So when the man they urinate frequently too much, he get many things, or he get metabolic disorders. So is something wrong? Yes, especially if you can't know, say you know they drink water too much. Hmm? You will need to see a doctor, make them check out. And let me sound a note of warning. Do not buy anything from anybody on social media. When you talk, say, I dey urinate frequently, somebody can't tell you, say, go and drink this thing, you go cure am. The person go spoil your body, it go spoil your man block us. And if your man block us spoil, you know now, shebi you understand. If your man block us not dey work again, you know what that means. You know, don't pretend. So be careful what you buy on the internet. This is why I always tell people to please see your doctor and don't take treatment on social media. Even me, I know they give treatment on social media. So be careful, I beg, I beg. But if you know one listen, no vex, it's your life, huh? You understand? I beg. Um, okay. She said that I have infection because you wrote a test for me to go to the lab. That is what they said, and the results. But for me, I don't see any blood in my urine. You know, here is not Nigeria. That is why I don't know what to do. Ah, yo, I don't miss you. I don't miss you. I am super. Hey, yeah, how are you? So sorry, let me see no vex. Your question or your comment, dey clear for my understanding. They said you have infection. Okay, you wrote a test for me to go to the lab. Okay, me and you don't communicate, me and you, right? Online and privately. I don't understand. No vex. So please, okay, you are not in Nigeria. You're somewhere else. Okay, let's do this. If me and you don't communicate privately, if we don't communicate privately before, I beg. Just go back and drop this your comment. Just go back and drop it there. They will forward them to me. Outside, me and you will talk. That is, if now you don't talk before, I'm just doing this because of your comment here. But if me and you never talk at all before, we not get any communication, no vex. So I will still maintain that. Please see your doctor there. But if we don't get an online consultation before, I will do this for you. Please just go back to that platform where they communicate and drop the message there, and then they go forward on to me. I will make out for you. Yeah, I beg. Okay, somebody is saying on let's have a comment on again. I don't tire. I have to go now. I don't get tired, ladies and gentlemen. First of all, before I end this live session, let me say something here. The food challenge is coming up very soon. Our challenge. I'm gonna drop the video soon. Though I have dropped the video on my private channel for those that subscribe. In case you want to subscribe to be among my private community, there you can see my videos. You can ask me anything. I will respond to you almost immediately and other stuff. You can look for the link to subscribe and join. And once again, I want to appreciate you for always commenting on my videos, sharing, liking, inviting your friends. I want to say a very, very big thank you to you. 2023 has been a very eventful year for me. I was telling somebody sometime this year, towards the end of the year, I said, this year, I started this year with zero amount, zero, like zero. I was very broke. But by the grace of God, God favored me, God showed up for me. So I have a lot of testimonies. And having you listen to me, having you join my platform almost every time I come online is such a huge honor, and I don't take it for granted. So I just want to use the opportunity to say thank you and thank you to every one of you, wherever you're watching me, on Facebook, on YouTube, on Instagram, on TikTok. I want to say a very big thank you to you. Kenichi, doctor, please, I'm sorry for this. Okay, you might have attended to it before. My network was bad. Okay, please, what could be the problem of a 27-year-old person seeing sperm after waking from sleep? Okay, the 27-year-old. I know some people have this superstitious belief, but there's what we call wet dream. If you are a man and you see the stuff come out, it means say maybe you dey get wet dream. That is, when you dey sleep, your mind fit dey tell you say you dey knack. At least you dey do well. I no go tell you say you get problem. You no get problem. You get. So if you sleep, you see say the thing come out. It's called wet dream. As a matter of fact, you're supposed to even be happy, say something they come out safe. But maybe now your mind they play with you. Maybe you don't go watch some kind things, or you don't listen to some kind things, so that when you sleep, your body go they tell you say you they make way, and then you they do and they undo. Understand? Yeah, but I know some folks now go come carry and talk say if you they see red dream, and this and they do you, my guy. Say maybe you don't know you knack. And the custom. Okay. Okay, good evening. Let's take this comment on Facebook. I have to go very soon. Please, does falling in love help deal with some mental health issues like depression or stress? I went to the hospital for my stress treatment, and the doctor asked me about my love life. And when I told him that I have never been in a love relationship for long, due to the nature of my business, he advised me to get a girlfriend. Prince, that doctor did well for you. Now, there are many things that can cause mental health issues. I don't want to mention the word. Hello, long time. Angel Samuel, how far? There are many things that can cause mental health issues. Your love life, emotional. See, we are human beings. Human beings, sometimes we need attention. We need love. Even animals need love and care, pampering. How much more human? So, if you have not experienced love in a very long time, you have not had anybody call you, check up on you, how are you, how have you eaten, I miss you, I love you, I want to hear your voice. Guy, it can affect you. You are not artificial intelligence, you're not a robot. So it can. However, I'm not a psychiatrist. There are many things to consider. So if your doctor considered all these things and maybe came to the conclusion that at least you need a woman in your life, then I beg you, you need a woman in your life. I'm not going to allow anybody to come to my page and tell me rubbish, say a lie, make it hustle. Guy, you go work, 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 work. You get all the money, but you don't get babe, you don't get wife, nothing, nothing. Come on, it will affect you. Hmm? I don't remember, no vex. I don't remember, no vex. Tell me your name again. It will affect you. So you actually need a woman in your life. You need somebody, hmm? A woman. Let me be specific. You are a man. You need a woman, a female. Yes. Let me talk with my full chest. Not somebody, a woman. Yes. Now, no, they bend mouth. You know what I mean? I'm saying it confidently, my full chest. If you are a man, you need a woman inside your life. So please try to, maybe your job, you're very busy, but please try to create that balance here. Please read my comments. Oh yeah, I'm trying to see your comment. Please send your comment again. Joy, I'm married now. I have a baby. Which joy is this? Which joy is a lie? Which joy is this? Which joy is a lie? Which joy? Let me see. Which joy? Which joy is this? I have many joys on TikTok. So let me know. I beg. Um, which joy is this? So I get many joys where they follow me. Oh my God, my Instagram don't go haywire. Away my phone. Oh, okay. I have a cloudy vision, and one part of my eye is shaking. Oluwaseyi, please, please go for eye check. I beg, go for eye check. Let them check you, please. Go for go for eye check. Let let them check you. Very important. Let them check you as soon as possible. Let your the the eye doctor please examine you and tell you what to do. Very important. What can I do to stop snoring? What can you do to stop snoring? So if you are snoring, what can you do? Number one, if you are obese, I would need you, if you are obese, I would need you to lose weight. You understand? That's if you are obese. Number two, um, if you are very stressed, I will tell you to take out time. Then your pillow, please take your pillow up a little bit so that your head is at a little bit 45 degree. Yep. Let's see. Let's see. Okay, let's do this. Let's do this. Why is this thing doing this to me? Let me do this. This one don't spoil. Oh, my Instagram live is gone. Oh, Instagram, no vex, so I can't. Sorry, I can't seem to connect you guys back. Let's see. Okay, I can't seem to go back live on Instagram. This one don't hurt me. Okay, I have to go now. I don't tire, but I'm not ready for marriage. Oh. That is why I don't want to hurt anyone. I'm out of Nigeria. I'm not planning to marry from Cotonou. Okay, my guy. Glory, how you day? Well, you might not marry immediately. However, before you go marry, you go need to date in a relationship. Glory, thank you. Before you go marry, Mr. Prince, you go need to date in a relationship now. You go need to date with a babe. Una go need to know una self. No be say you go just meet a woman today and immediately you go marry am. As a matter of fact, not be everybody where you even date you go marry. Say because me and you date now, therefore we must marry. Glory, thank you for this heart. God bless you. Not everybody you date you go marry. Don't let anybody guilt trip you. if you deal with somebody and una know they compatible, or the person head no well, or the person no get the same value where you get, you understand, or una know they go the same pace for life, nobody say you must marry. But wetin we go advise you be say, at least try to date in a relationship, so that as you then you go dey build small small, they build small small, and then you go come marry. Huh? You sure you get? Yeah. Okay, somebody says, I want to take you out. You want to take me out? Really? Let's see. People on YouTube. Oh yeah, everybody share this live. I have to go now. My time on the live session is almost up. Glory, how are you? Why are you laughing? Ife, why are you laughing? Why you they laugh? About far, I talk spoil. Abi, did I say anything wrong? Bolanle, Deborah, I sent you the link now. Go and click on the link, Deborah. Go and click on the link. Somebody wanted to take you out. Yes, now. Somebody want to take me out. Yes, you can take me out. So Bolanle Deborah, please go and click on the link. I dropped the link there. Go and click on the link on our platform. Oh yeah, I want to bring you up now. Quickly. What about you? I'm good. I'm doing very well. Ibam. Okay, so I don't know whether I don't talk spoil. Somebody say he not ready for marriage. So I just gave him, take me along. No. Doctor, please, are you married? No, I'm not married. Actually, I'm not married. I'm not gonna lie. I'm not married. But at the same time, I'm not into, you get. You get people we get power pass me. Maybe they watch this video. So I have to be responsible. I have to be responsible. You get, right? You know, I'm not married, but at the same time, I'm not the fine woman again. Yeah. Doctor, you dey enter the lady's eye, my dear. Even many ladies they enter my eye, but me too, I don't close my eye. Okay. Please, my blood sugar is 160. Is it okay? Glory. Thank you for the treasure box. Thank you. Your blood sugar is 160. So is it a fasting blood sugar or random blood sugar? Even doctor, is it a fasting blood sugar or random blood sugar? Your blood sugar, is it a fasting or random? Doctor, I define wife for help my ministry. Okay, ladies and gentlemen, we have a young man in the house. He's looking for a wife. So if you know you are a wife material, please indicate. Maybe una two can hook up. Yes, fasting. So it's high. Victoria, your fasting blood sugar is high. If not fasting, it is high. Here in Germany, women no dey. Na lie. Women dey there. I know somebody will tell me say women plenty. The person even dey here. Then plenty for Germany. Then plenty for there. Then plenty. Women dey there. Then plenty. Are you for real? Vivian, good evening. How are you? I know him. He's not rich. We plenty. Okay. Ladies and gentlemen, this is the time for me to catch cruise. Let me spend 30 minutes more and then I'm done today. Let me spend 30 minutes more. This is the last program for the year. So I might spend few more minutes and then I don't go. Okay. Share the live. They say you know get money. I know him, he's not rich. They say you don't get money, that is why they don't want to follow you. People on YouTube, on Facebook, when I know they comment, you're looking at me. Ask me a question now, but please don't ask for medicine. I know we'll give you medicine. I'm having business daughter. What can I do? I don't understand your question. Ife Hopkinson, thank you for the rose. Thank you so much. Thank you. Everybody follow my gifters. Okay, I'm having dizziness. Oh, you're having dizziness. Ah. Okay. General advice. I beg of you. I beg of you. There are many reasons why you can develop dizziness. Listen carefully, I beg, especially for those who just they follow me for the first time. For those who just they come to my page for the very first time, I beg. I know they treat anybody on social media. So in case you define your diagnosis here, I beg, I'm not going to tell you any diagnosis. But generally, if you feel develop dizziness even because of your blood sugar, you feel develop dizziness because of your blood pressure, you feel develop dizziness because of your blood volume, you feel develop dizziness because of your ear, you feel develop dizziness because of severe forms of stress, you feel develop dizziness because you get something where they affect you for the head. You understand? So if you come online and you say I dey get dizziness, I cannot lie you, we no fit prescribe anything for you because we no know why you dey get dizziness on social media. We need to know more. We need to know wetin be your age, which kind job you dey do. We need to know if you dey get other symptoms like you dey feel like vomiting. We need to know wetin be your blood pressure. Many things dey involved. So we no fit just come online and tell you say, oh, you get dizziness, go and do this. No medical doctor trained will do that one for you. That is why I'm very careful. So if you dey get dizziness, my general advice for you, general advice now, beg, if you know say you know dey sleep well, if you know say you know dey rest well, you know dey chop well, do those ones first and check your blood pressure. Now if your blood pressure dey okay, you dey chop well, you dey sleep well, and yet you still dey feel dizzy, speak with a medical professional and make e check you. Doctor, I want to ask, is it good for a pregnant woman to be urinating every 1 hour? Every 1 hour. Okay, let me see. If woman dey pregnant at the very early stage, she no go dey urinate often. That is number one. Every 1 hour is too much. So if your pregnancy, you don reach the third trimester, that is, you don dey near time to born, your pikin, let me see if I can show you the picture. Let me see if I can show you the picture. I wan show you the picture online. I want show you the picture online. I want show you. I go show you here. May you see am. Because if you don't reach your third trimester, when the belle don't go far well, your belle, man, see. I want show you the picture. I want show you the picture. No one they come up. No one is coming up. No one is coming up. I want to share something online with you. Okay, good. I don't see one. I don't see one. So make I show you the picture, and I hope that you go fit see am. Let's see. I want to share my screen with you. Come, I dey multitask. I do many things at the same time. My head, oh my god. I look talk. I dey look this. Oh my god. Okay, let's see. Okay, let's see. Make I share one with you. Share my screen. I want to share my screen with you. I'm about ending the live session now. Let's see. Okay, good. Now, let me see. Tell me my screen. Those you can't see my screen on YouTube or Facebook, so you can go to my YouTube live and you will see my screen now. Okay, good. Let me see. Can you see the screen here? If you look at the screen, let me see. I want to see if you are here because I go soon end the live session. I don't tire. No, they give me star. Nobody don't send me star. Nobody don't give me super chat. Nothing. Ha! Wow. Okay. So let me see. Now look at this baby here. You see this pikin? Look under here. This is the bladder. I hope you can see my mouse here. See the bladder here. When this belly go this pikin go dey press the bladder, and when the pikin dey press the bladder, any small urine wey dey inside, she go dey rush go urinate. Okay, you dey see am, abi? So when the baby don dey grow, you go dey see am, this thing here na the bladder be this, and when the pikin dey press the bladder, any small thing, the woman go talk say, I want to go urinate, because the baby dey press on the bladder. Na im dey make the woman go urinate every time. Make her go urinate. However, if you no dey that phase of your pregnancy and yet you dey urinate every time, e go dey important for you to see your doctor, make dem confirm whether you get UTI. If you get urinary tract infection, they go give you medicine. Thank you for the gift. Thank you, sir. Thank you. Yes, you have seen the screen, abi? Very good. So e go dey important. Make them check. If you dey your third trimester, you don dey near to born, maybe the pikin and they press your bladder, you dey piss every time. Thank you, sir. People for here just dey look me. They no share my life. They no share. They no send star. They no subscribe. They no invite their friend. And wow, don't do like this next year. Now see how many people share this live. Only 9 people. Only 9 people. 9. You don't do. I beg. I don't close. I follow people on TikTok. I beg. Blessing at them, they appreciate me. People on Instagram, on Facebook, just they look me. Una no share. No nothing. Only 9 of you. 9 share. Ha. Odabo. God bless you. Thank you. This is the last session for the year. I don't even go past the time. I just wanted to have fun and discuss with every one of you. But I noticed say una no even send me at all. Only 9. 9. Haba. Jesus. Now so them be human beings. Anyway, okay. How early can one detect pregnancy? How early? After your first missed period. Yeah. From 6 weeks. From 6 weeks. Yes, I'm very close to my time. Okay, you are very close to your time. Good, very good, very good. I see. Bolanle Deborah, are you here? Bolanle Deborah, how fun now? I sent you the link now. Bolanle Deborah, una no click on the link. Click on the link. I want to talk to you. Okay. Okay, let me take this last question here. Good evening. I have been having this deep pain in my upper back. Been to the hospital and a scan was conducted, a scan or x-ray, and nothing was found. But the doctor said it comes with age, just like arthritis. I don't know if I'm correct with the word. Okay, I'm Chibuzo. Maybe na arthritis you get. Maybe you get problem for your spine. Having this pain, yeah, you can actually develop arthritis at any part of your body because of your age, Mr. Chibuzo Anyanwu. It comes with age and maybe the kind of job you are engaged in. Yep. Thank you very, very much. So I want to wish you all a prosperous new year. I want to say thank you joining. Yes, I made a video. And I said something. So let me say it openly. I don't know who's watching me right now. If you know you have a story, if you know you have a story to share, maybe you had a medical condition, you want to share your story, you want to share your experience with people, you want them to hear you, send me an email. My email is on the screen here. Send me an email. I will have a session with you and I will share it online. If you have a story, let's say you know someone or a relation had maybe cancer and you want to talk about how it happened and this and that and that. Just you want to share your experience with people. If you want to do that, share your experience with me. Send me an email. My email is on the screen. When you send it to me, me and my team would review your email, your story. I will send you a date. We'll have a session with you. You understand? And then we'll post the video on Facebook, on my page, and on YouTube. I will share it for people to hear you. I'm doing this now. I know that people don't like free stuff. Human beings know they like free stuff. When something they free, they know they value them. That is why I don't tell myself I don't will give anybody any free consultation, because people know they value free things. But this one, if you know, say you get a medical experience, you or somebody where you know, you want to share the story online. 2024, I go make out time. Me and you go discuss online. I go record them and I go post them online. Make people hear. You understand? You are not paying me anything, and they're nothing. I'm doing that for you as an individual. But if you want to come online to market your products, I'm not going to do that one for you. I'm not doing that. I just want to share people's experience. Oh, this thing happened to my mother. Oh, this thing happened to my father. Oh, this thing happened to me. I wish I listened. I wish I went to the hospital on time. I wish they did this for me, so that people go hear from you. That is what I want to do. And if you know you fit into that category, please share your experience with me. What about trigger finger? Trigger finger, most times, job related. Job. Trigger finger, yes, sometimes job related. Yes. Like the custom. So everybody online, thank you very much. Thank you for watching. And I have to go now. I will see you all next year. Remember, good life now waiting. Good life in a sense.